In 2018, finasteride was prescribed over 8 million times as just a general estimate in the US alone. Finasteride, better known as Propecia, is a hair loss drug, and how it works is on an enzyme called 5-alpha reductase inhibitor. What this does essentially is to keep testosterone in its more native form as opposed to allowing it to turn into DHT. DHT acts particularly on hair follicles, which results in miniaturized hair, weaker hair, smaller caliber hair. They tend to break and fall out easier. It doesn't work for everybody, but it does have some pretty profound effects, which we'll get into here shortly. The mechanism of this, basically the first couple months is designed to sort of rejuvenate the hair follicle. There should be perhaps a little bit of change. You might shed a little more hair during the first portion of this. This is generally temporary and normal for most people. As always, consult your prescribing person and ask specific questions regarding your individual physiology and health. The hair follicles are hormonally sensitive, as are many other tissues in the body. Many times men are concerned about the side effects, which they read about on blogs and online, which include decreased libido, decreased erections, and decreased ejaculatory volume. It's more than just testosterone that can affect these things. Obviously, these are well-known side effects, but as always, because this drug does work on a hormonal pathway, you want to discuss this with your provider, whether it's a testosterone panel, other stress factors, lifestyle factors, diet, body habitus, other conflicting medications that have side effects. All these can sort of mix together in the milieu that causes sexual dysfunction. So it's important to measure, and it's important to have some idea of what baseline labs are and what normal or anticipated results could and should be. Obviously, hair loss is very complicated and can vary from men to men based on genetic factors and lifestyle, heavy metals, a whole host of things go into the mix. So it doesn't necessarily work for everybody. The shedding, as alluded to, can and does occur for many people. This is because the weaker hair follicles are believed to be pushed out or falling out as the hair follicles are rejuvenated based on the action of finasteride in the whole process. Around 3 to 6 months, it's anticipated that there could be some slowing of hair loss and hopefully some hair growth. It's important to track progress. A simple way to do this is just take a picture. Oftentimes what you can see in the mirror may be different than what your significant other is seeing from top or backside. So document with the camera, a great idea just to track progress and to really make an informed decision about whether or not to continue this medication. Obviously, hair loss is a emotionally charged and a personal issue, not a requirement, but often viewed by many as a necessity just for image and appearance, basically. So the PSA can be affected by this as well. It's important that your doctor knows any and all medications, including supplements, that can be taken. The critical piece of this is that PSA can be altered by finasteride, and there is a concern about prostate cancer risk. This is more common with the 5 milligram dose than the 1 milligram dose, which is typically prescribed by most providers for hair loss. There are some alternate regimens out there that are on the internet. Whether or not these work or whether they're effective, it's hard to say. Just keep that in mind and have a candid and honest discussion with whoever is giving you this prescription. Other common side effects, as alluded to, is decreased ejaculatory volume, which can be a concern, particularly if childbearing is in the works. Most providers would recommend against starting this if planning to conceive, or if there's been some difficulty conceiving. Obviously, discuss the issue with this drug as a well-known side effect. Follow the recommendation. Unfortunately, patients can and do get themselves in trouble by creating their own recipe, if you will. More is not always better with many drugs. There is a certain pharmacokinetic threshold where problems can do and will occur. As always, if you're unclear about whether or not this is the right dose, right route, right option for your particular situation, ask and discuss with your provider. There are many options out there for hair loss. Some are tried and true, others are more cutting edge and on the cusp of scientific advancements. There are a lot of things out there that many people are unaware of, so this is not the only silver bullet, if you will, in the gun. If you like content like this, be sure to subscribe. As always, be safe, be well, have a fantastic week.